Thank you so much for joining us. As folks trickle in, we'll be starting in just a few minutes, but we're really pleased you're here to join us for our discussion on our Family Benefits Report Card across the states. Keep in mind as you log on and throughout the webinar that you can use the Q&A function to log a question for any or all of our panelists. Feel free to add questions while the webinar is unfolding, and I will be picking some to highlight at the end of the panel. Thank you. As folks are logging on, we'll begin in just a few minutes as people all open their Zoom windows. At this point, if you're coming in with any questions, having pre-read the report, or as you hear about the report throughout the panel, feel free to use the Q&A function at the bottom of your screen to add questions for our panelists. There's no need to wait till the end, and I'll be highlighting questions when we get there. All right, I've been tracking the second derivative of the attendance number, and I think we're about ready to start with an introduction to our panel and our panelists. I'm very pleased to be here for our webinar on the Niskanen Center's report card for 2023 for family benefits in America. This report was assembled by Joshua McCabe and Julia Pelletier. And we're going to take a look at the most common family benefits across the states, their impact on family resources, and how they support families through changing economic and employment circumstances, particularly when families move from a period of unemployment to minimum wage jobs and from minimum wage jobs to median wage jobs. I'm dropping the link to the report in the chat for your reference. I'm going to be the moderator for this panel. I'm Leah Sargent. I'm a senior policy analyst in family economic security at the Niskanen Center. And I'm joined by Joshua McCabe, the director of social policy at the Niskanen Center and one of the authors of our report. And by Keith Barnes, the senior director of Beyond the Cliff at the Martha O'Brien Center. And Alex Haralampudis, who is the director of data and analytics at the Prenatal to 3 Policy Impact Center. Josh will kick us off with an overview of the report, and then we're going to have responses from Keith and Alex, and then I'll have some questions for them. And throughout the webinar, you can submit your questions through the Q&A function, and I'll be highlighting some of your questions alongside my own as we go. So with that said, take it away, Josh.
Awesome. Thank you, Leah, and thanks to everyone for being here. I do have some slides. I don't normally use these, but we have some really cool figures in here, so I wanted to share those with you. So I'll go through this quickly, but I really want to open up this discussion and see what everyone here thinks. So why did we write this report? And why did we release it now? So this report is I think a long time coming. Part of it is we had a great intern this summer, Julia Pelletier, who's my co-author on this report. If you're looking for an intern next summer or when she graduates, I highly recommend her. But this report was really inspired by several reports before me. And I really think of it as standing on the shoulders of giants. Gene Sterling did some really cool reports on implicit marginal tax rates and different benefit levels back in the 90s and early 2000s, and more recently. Jenny Romich is a sociologist who's done really good work on this. And then if you know me, you know I'm always looking at Canada. And part of this was pushed by the Caledon Institute in Canada, had a really good report looking at all the cumulative benefits that families are potentially eligible for. So I wanted to build on that, because we often are in silos when we're looking at policy. We're looking at TANF, we're looking at tax credits, we're looking at SNAP, but families are potentially eligible for all these programs. And when they have changes in their family status or their income, it affects all of these programs at once. So we really want to see what are the cumulative impacts of some of the most common programs. And also this was inspired by recent changes in state minimum wages, right? So they vary a lot through the country, and $15 minimum wage is not uncommon. That was very uncommon, I think, when the EIT started out and we started expanding it. So I've been thinking a lot about interactions between the minimum wage and all these different benefits to think about how a minimum wage worker might be impacted. And lastly, and I think most importantly, since 2021, a lot of folks have seen the CTC at the federal level, which was fully refundable, and $3,000 as a new North Star. That went away. That was temporary. But as of last year, 10 states had fully refundable child tax credit. So this means you could get the full credit with zero income, right? And this is something we saw in 2021. It didn't fully go away. We still have it in 10 states. So I really wanted to update some of the work of these earlier folks by looking at what is the landscape now. So now I'm going to go through some of the different policies we looked at, how we modeled it, and some of the initial findings. So we looked at 6 major programs. 2 of them are what we think of as social assistance. The first is temporary assistance to needy families, or TANF. So these benefits range from over $1,000 a month for a single parent with a child in New Hampshire to $164 a month in Arkansas. And these typically phase out as parents move into the full-time work. And this is really what temporary assistance is for, is to help you when you're down and out, with the idea that you potentially lose benefits as you go back into work. There's been a lot of decline in this, so we want to see what does this look like relative to 1996, 2006, or even 2016. Similarly, there's the SNAP program, or Supplemental Nutrition Assistance Program. It's a near cash benefit, so it can be used pretty widely on different types of groceries. Maximum benefit of over $500 a month for a single parent with 1 child. And this one phases out a bit more slowly, and we've seen a lot of expansion over the years, especially with broad-based categorical eligibility, BBCE. There's some variation across the states in terms of how quickly this phases out. When does it phase out? Are there any benefit cliffs involved? So we wanted to see how that impacted things. We also want to look at refundable tax credits. So these are now probably the major social policy for families in the US, but we have these at the federal level as well as the state. So I think the most well-known one is the Earned Income Tax Credit, or EITC. So this is up to almost $4,000 to $7,500 per family, depending on number of children and your marital status. And we see it's got this trapezoid shape. It phases in, it plateaus, and it phases out again. And you can see why this might have piqued my interest with the minimum wage. Just for reference, the federal minimum wage is $7.25. That works out to about $14,400, versus a $15 minimum wage works out to about $30,000 a year. So depending on what your minimum wage is, you could be in the phase-in range, the plateau range, the phase-out range. So this is going to vary a lot for families depending on what they might be making. I don't have a figure for state minimum wages, but most are set as a percentage of the federal. So it's going to look something like this, but a smaller version, ranging from 10, 20, 30%, depending on the state. California is the sort of weird exception here. We'll come back to them, but they don't set it as a percentage of the federal. And then the federal child tax credit, we've seen a lot of changes over the last few years. This is also refundable, so it's going to phase in a a similar way to the EITC, but with some small variations, where it takes a bit more income, and you can see on those different lines to phase in fully. But families can receive up to $2,000 per child, and that doesn't necessarily phase out until they're making $200,000 or $400,000. The fun part, and this is going to be one of my favorite figures, is that state child tax credits look very differently, right? In two different ways. First, they're fully refundable, so there's no earnings requirement. So you get the full credit in most states when you have zero earnings, unlike the federal one. But that is where a lot of the similarities end. There's lots of different phase outs. Some phase out at very high rates. Some don't phase out at all, such as Massachusetts. Some phase out relatively low. Some will, as the threshold for phase out begins, you lose the entire benefit or a large portion of the benefit. Some will phase out at a lower percentage. And again, if we think about this interaction with the minimum wage, right, I think 15,000 or 30,000 is about $7.25 and $15 an hour. There's going to be a lot of variation on what a family working full-time with minimum wage or the median wage might be able to get here. So this is something that hasn't really been explored before relative to those past focus on these cumulative impacts. So this is, I think, where the meat is. So what exactly did we do here? There's lots of different decisions that can potentially go into this. So we want to be really, really explicit about what we did and some of the limitations there. So we looked at 6 benefits total. The tax credits we mentioned, TANF and SNAP. On the tax credits and SNAP side, these have relatively high take-up rates. So we're looking at, 75 to 90% take-up. Versus TANF, I want to be clear, it has a lower take-up rate. We're looking at 20 to 30%. But these, I think, are the major benefits that most families are going to receive. So we didn't model other taxes or potential programs. So keep in mind, people are paying federal taxes, payroll taxes, state taxes. They might be receiving child care grants or housing assistance. Those have relatively low take-up rates as well. We didn't include them there, but these things might look different if they were included. Looking at implicit marginal tax rates, lots of different ways to do this as well, right? Do we look at what happens if you earn an additional $1,000 or $2,000? But we want to set it in a way that we thought reasonably approximated real-world families. So we thought about no earnings. We thought about state minimum wage earnings, and one of the advantages we hope here is that, again, the minimum wage, it's twice as high in Massachusetts as it is in Alabama, so we want to reflect something like that here. We also want to reflect state median wages. Again, lots of diversity across different states. So if we're looking at the diversity in terms of TANF or EITC, we also want to look at that diversity of state minimum and median wages. A bunch of other simplifying assumptions, right? We assume a single parent with 1 young child and a married parent with 2 young children. This was just to make sure we could do 30 different family types. That would be a lot of work. So we just ended up doing 1 single parent with 1 kid and a married parent with 2 children as sort of our model families here. We also assume just wage income, that there was no elderly disabled members in the household, and several other simplifying assumptions here. Right, so this is something to keep in mind, that families are sort of diverse in their experiences, what they may or may not be eligible for. So this is an approximation of, we hope, a reasonable number of families, but there's going to be a lot of variation within here. All right, so what were our major findings for all of this? What we wanted to do is look at total benefits with no earnings. If you go on the left, it's the single parent with 1 child, and on the right, it's married parents with 2 children. So we can see there's a lot of variation in total amounts, but also the source of those benefits. Right, so in California, you're looking at close to $19,000 for the first family, close to $30,000 for the second family. And this is about what the federal poverty line was last year. So it's 20,000 for the first family, it's 30,000 for the second family. So in those states, those benefits alone are approximating what you would expect the federal poverty line to be. At the low end, it's about 2/3 of the federal poverty line. And this is just one measure of poverty. If we looked at the supplemental poverty measure, if we looked at a relative poverty measure, where the baseline is the median in that particular state, these might look a little bit different, but we wanted to set some sort of baseline so we could see in federal poverty measures is usually the most common one. The other interesting thing here beyond variation across states was the source of benefits. And I think Minnesota versus Vermont is a good example. So if you look at that married couple with 2 children, in Vermont, they're receiving a lot more of their income from TANF in this case, and a lot less from the child tax credit. In Minnesota, it's the inverse. They're receiving less from TANF and more from the child tax credit. So I think this is really important in terms of thinking about how we want to help different families, that there's more than one way to do so. That child tax credits can be a big source for low-income families. TANF can be less, and you can get the same impact as we see here with these 2 states. And what happens if you look at a minimum wage? Again, lots of variation in total amount and source of benefits. And part of this is going to be what the minimum wage is in each state. So in California, minimum wage last year, I think was $15.50, right? So those families are getting a lot more earnings. They're going to be in a certain part of the income range for the EITC or SNAP. Versus Minnesota, it's was only $10.59 last year minimum wage. So they're going to have lower earnings levels, and they're going to be in a different spot for all these different benefits. So this influences where you are on the EITC trapezoid, on SNAP, but there's also some major differences with the child tax credit. So if we look at that red or crimson bar, we can see it doesn't even show up here for California or Maryland, and that's because those phase out so quickly that a minimum wage worker working full-time isn't eligible for either the child tax credits in those states. Versus others, the child tax credit is still a significant portion of the benefits that they're getting. What about implicit marginal tax rates, right? This is something we care about because we want to make sure not just that we're helping families, but that we're giving them the ability to move upward. So we usually think of a minimum wage job as a stepping stone to hopefully a median wage job in the long run. But we want to make sure families are moving from welfare to work, and then from low wage work to moderate wage work. So the thing with a lot of these benefits, as they begin to phase out, they create these implicit marginal tax rates that you lose X amount for each new dollar you earn. So we want to make sure that families are going to be better off, or they're not going to lose a significant amount of their benefits as they move upward. So with this first one on the left, we're looking at implicit marginal tax rates when people move from no earnings to minimum wage, or from welfare to work, as folks said in the 90s. And we see that these range from upwards of 40% in California to very low or negative in places like New Jersey, in New Mexico. So the big difference here is first TANF generosity versus EITC generosity. So we had mentioned California has very generous TANF, but it has a relatively narrow EITC and CTC, right? So you're losing all 3 of those if you move into full-time work. Versus New Mexico and New Jersey, TANF and isn't particularly generous, but they're still keeping a lot of those tax credits as they move into full-time work. So these, I think, are lower than what we saw in the 90s when we saw welfare reform, where I think implicit marginal tax rates of 70, 80, 90% were more common than they should be. So we've done a lot of great strides in reducing these barriers for moving from welfare to work for families. But something else that the report found was the way we've done this is we've pushed a lot of these high implicit marginal tax rates further up to families just above the poverty level. So we've used EITC, we've used SNAP, we've seen some retrenchment in TANF. So families have a greater incentive to move from welfare to work, but they're losing a lot of their benefits when they go from something like a minimum wage job to a median wage job. So that poverty trap that we were worried about in the 90s seems to have become a just above poverty trap now. So depending on the state, you're looking at 40 to almost 60% implicit marginal tax rates as families get a new job, gain new skills, and try to increase their earnings. And I think lastly, something we tried to do in this report was break it down for each state. So we looked at the 10 states with refundable credits. I use Massachusetts here because I am a proud masshole. But we have these for every state there is on this list, where you can really look at what does it look like in terms of TANF, SNAP, tax credit benefits, implicit marginal tax rates. And we break it down so you can see where it's going well and where there might be some issues. So we think a holistic understanding is important for good policy making. So we hope that policymakers and advocates in each of these states are able to use these tables to think about where they want to go next with reform of all these different benefit programs. And we plan to update this annually, so we're excited to add Maine next year. It didn't take effect this year, so we didn't have it, but we'll be up to 11 states in 2024. We'll be interested in what other information would be helpful to include as we move forward with this. So it's in the chat, but if you want to read or share the report, you can find it on our website. And I will turn this off now so we can turn it over to Lee again. Thank you.
Thank you so much, Josh. And I appreciate you reminding all states that they're on notice that the report will be annual, so they have time to improve their standings. I'm going to turn things over to Keith Barnes and Alex Heron-Lamputis to respond. Keith, why don't you go up first, and then you, Alex, and then I'll pose a few questions. Everyone attending, you're welcome to submit questions in the Q&A portal.
Thank you. And yeah, thank you for the invitation. Thank you for a really informative report. I wanted to just offer a little context for who I am and why I'm here. I work for Martha O'Brien Center, which is a faith-based nonprofit that has been in existence for 130 years, serving particularly the Casey Holmes community in Nashville, which is one of the deepest concentrations of poverty in our city and in our state. And it's through that work that we came to recognize, so I'm heading up the Beyond the Cliff initiative. The cliff in that is benefits cliff. And so Josh spoke to that. There's a lot of things that kind of get put under that heading. I'll say briefly, it is those marginal tax rates. It's another thing that got mentioned in the report of the fact that, yeah, there are just some arbitrary income cutoffs, right? So if you just happen to make $1 over an arbitrary threshold for SNAP, you can go from receiving several $100s a month potentially in food assistance for your family to nothing. So that's what we mean by benefits cliff. We encountered it firsthand here at Martha O'Brien. And one of the things we did, we're doing now in partnership with our State Department of Human Services is we're testing an intervention that asks what happens essentially if we get rid of those marginal tax rates and those arbitrary cliffs, right? And what can it look like? What can a better system look like for a family to be able to move forward? Building off of that work, that's where Beyond the Cliff came in, where we built this wider coalition of 13 partners from across the country. It includes state agencies, county governments, workforce development providers, and social service organizations who are all similarly testing interventions that help families move forward past some of these, marginal tax rate challenges, and other sort of cliff effects. So that's just a little bit about me and where I'm coming from and why hopefully I can, add a little insight and perspective in this discussion. So, what I would say in just kind of broad brush reaction, first of all, I really appreciate just the family-centered approach that you took in this report, right? Families don't just experience these things in the silos in which they get legislated. They're living it every day and they're navigating it. And it can be scary and confusing. And at times it creates true barriers to getting ahead. Um, I think, opportunities, and totally understand this stuff is so complicated, but just want to highlight, and you did mention this, Josh, but like the non-cash assistance is also really important. And that's what we see, if especially like, let's say you've got a family that does have higher healthcare needs. Essentially that marginal tax rate for them when they lose Medicaid or access to CHIP or have difficulty navigating the marketplace to the sort of the right plan for the right subsidies. Like all those things stack up, and that's sort of an additional barrier for families that are able to access childcare subsidies and housing, which I think you also spoke to, Josh, is there's sort of limited supply and assistance, but for those families that are able to access those benefits like that, again, just it continues to stack up against really being able to move forward. So I think, one thing I would say from like what state policymakers can think about in this is really being thoughtful about, taking a similar approach, right? Like, let's look at this from the perspective of the family and where where we all, the families themselves and where we all want to see families thrive, and what does our I think in this case tax code, right, need to look like to help support that. And I think there is a lot of opportunity, and I think you've done a really great job of highlighting, where where things are working in some places and where there are opportunities for growth in others. And the other 40 states in the union, as I understand now, are on notice, and DC. I shouldn't leave out DC. So, I think there's a lot of opportunity there. Some of the other things just that I would highlight to think about, like part of the reason we're doing this coalition with practitioners who are testing interventions is we recognize that there is sort of the on paper, right? There is the eligibility limits, but there's also, it is that lived experience and what does it look like, not just to make it so that the eligibility rules line up, but also what does it look like to actually, have a public human services system that is fully aligned towards economic mobility. So I think even as we're, potentially making shifts in tax code, we should also be thinking about, how are we supporting those families? Are we delivering services sort of over and above tax benefits in a way that's strengths-based, that is goal-oriented, that is aligning to career pathway opportunities? And sort of the subtext of that is, are we making the investments so that public human services can operate in that way? Because right now, across a lot of public assistance, it is a very sort of compliance-driven regime, and that, stewardship of taxpayer dollars is important, but equally important in that is not creating barriers for families, because then we have we have a larger tax base. We're all prospering together. Some other things I just wanted to make sure to touch on. Just generally, I think this report does a great job of just highlighting the fact that we do have sort of a patchwork system, and that is also sort of adds to those barriers families navigate. When it's not, when you have to go to multiple different agencies and sort of tell your story over again, provide the same paperwork over again. These are barriers that are preventing families from focusing on opportunity. And then let's see. the other thing that I would highlight that we're sort of encountering as our coalition, and I did mention we're still just a few months in, so we're early days, but we've started comparing notes. Our ultimate goal is to develop a policy agenda to figure out like what should the system look like. But some of the things just from sort of preliminary comparing of notes that I would want to highlight is I think it's the marginal tax rates, it's those eligibility cutoffs, but it's also against the backdrop of an official poverty measure that is used to benchmark a lot of eligibility for public assistance that it doesn't work. It doesn't match reality. I know there's some other metrics out there that have higher numbers. You know, I won't get into the debate around like which sort of living wage calculation or self-sufficiency calculation is the correct one. But certainly it's higher than where we're benchmarking poverty now. And I mean, just to the challenge there being, you know, in Nashville, it's about $26,000 a year for a family of three. For us, the EITC is phasing out at well, I guess across the federal EITC is phasing out at about $56,000 for that same family, which on paper looks great. But then if you look at like the most conservative of the sort of the more updated like cost of living measures, that's 62,000. So you're losing the EITC is phasing out. You've way already lost SNAP. You've lost SNAP at half that 62,000. And so that's, I think, another important thing to think about, and for policymakers to think about sort of that, like comparing California over here and New Jersey over here in terms of those tax rates it's good that it's a little bit negative because those families probably aren't at the wage where they're fully making ends meet on their own yet. I think some other things to think about are just the timing effects. So you know, you lose SNAP almost immediately when your income, you know, if you go over income. You're not claiming those tax refunds until months later. So I think those are other just things for us to keep in mind. But I have a lot more I could say, but I think those are some highlights, and would love to just turn it back to Leah.
Thank you so much, Keith. And I really appreciate that point about the different triggers or feedback loops for when people are crossing thresholds. You know, you get much more anxious nearing your SNAP cutoff than thinking about exactly when you're crossing your EITC phase out. So we can adjust one, but kind of not alleviate the anxiety of the other necessarily. Alex, I want to turn it over to you for your thoughts and the way your own work leavens your response.
Great. Thank you so much, Leah. Hi, everyone. Thanks for joining us today. This is such an incredible report. Just a quick intro. My name is Alex Hare-Lamputis, and I'm the Director of Data and Analytics at the Prenatal to 3 Policy Impact Center at Vanderbilt University. And we aim to help states accelerate their implementation of evidence-based policies that help young children and their families thrive from the start. And, you know, as again, this is just such a great report, and I'm really happy to be here and talk about it. It really quantifies these cliffs, right? And it's something, you know, as our director, Cynthia Osborne, she travels around to different states. She hears about them often, right? People will say, oh, you know, we're worried about this cliff. And then I get the email that's like, hey, I heard there's a cliff. You know, try to find it, like dig around in the data, try to find it. Because often policymakers and advocates are hearing this, right? Like from people on the ground, as Keith was saying, right? People are trying to navigate this really complex system. So I really love that this report, you know, dealt with a very complex topic in a way that's really understandable and quantified things, right? And I think to go back to one of Keith's last points, you know, even when you don't have like above 100% IMTR, right? A lot of times your costs with working more and earning more are increasing, right? With childcare, you know, with whatever your costs are, right? And so it's really important to understand how these benefits are affecting families as their income increases. And so the way I'm going to structure these remarks is I'm going to dive into like some really nerdy details of this simulation and then a micro simulation that I also run. And then I'll wrap up at the end. I'll try to bring it all back together at a higher level. So at PN3, we have what we call the policy impact calculator. And what that aims to do is just figure out what are the total resources a minimum wage worker has across all 50 states and the District of Columbia, considering the evidence-based policies that we've identified from reviewing thousands of research studies to see where there is really rigorous causal evidence that these policies affect outcomes that we associate with kind of the science of the developing child, right? Helping young children thrive from the start. And so our simulation thinks of a woman we call Lena, and she's a single mother in a family of 3 with a toddler and a newborn. So when we run the simulation, we consider paid family medical leave in the states where it's available because Lena takes 12 weeks of leave under the Family Medical Leave Act. Both of these children are also in childcare at a center-based care where mother pays 75% of the market rate. And she's receiving a childcare subsidy. So in 2023, Leah, thank you so much. She just dropped the link. We see this huge variation across states in the amount of resources families have to care for their children, ranging from $20,000 in Georgia to $49,000 in DC. And next week, everyone get excited, 1 week from today, we'll be releasing our 2024 results. And, that variation is still very much there. We have a new leader and new bottom ranked state. Stay tuned. But what's really important is that all 10 of the states highlighted in this report, I think not surprising, right? These are states that have CTCs, that are more generous policies in general. They're all ranked in the top 16 in our 2024 rankings, and one of these 10 states is going to be number 1. And the top ranked state, the family has almost $13,000 in state tax credits. And really, I think that speaks to a lot of the innovation that Josh mentions in the report, right? States are doing really new things, right? So for the EITC, we're seeing states like Washington, right, that don't have a state income tax that have now instituted a rebate, which they call an EITC, and families are receiving very crucial resources, right? When you look at the proportion of their total resources that are coming from state tax credits and SNAP. And then also just kind of the huge growth in CTCs. And what's really hard for a center that is really evidence-based is that child tax credits are not part of our state policy roadmap, right? We currently don't have enough rigorous causal evidence at the state level to say that these credits, affect the outcome, the very specific outcomes that we look at that are related to healthy child development. And that's because, up until 2020, there were very few states with CTCs, and the states that had them, they were very modest. And now we're seeing states just really, invest in them. So that's, a challenging thing, for us to navigate. And also, I think, for everyone on this call to figure out when you talk with states, how do you advise them when it comes to designing a CTC? Especially as, they're not indexed to the federal. A lot of them have very different maximum incomes for the benefit. And then, some states are adjusting them for inflation and some aren't. And there's really great research out there that shows when you don't index these credits for inflation, they lose value very, very quickly. Our model also includes state income tax. And what I think is really interesting is that for the minimum wage worker, that's in almost all states, it doesn't really matter, or it's very small. But I think this median wage worker, it is going to contribute to a lot of variation. And so between that and childcare subsidies, right, which are a huge value to low-income families who receive them, right? And in a lot of states, it's a very small percentage of eligible people who do get to receive them, but they provide tens of thousands of dollars in benefits and really contribute to big, big cliffs. So with thinking about childcare subsidies and state income taxes together, I really look at this report as providing, this is kind of like at a lower bound, right, for what the IMTRs are in these states. So those are all kind of my like nerdy comments on the little details, but So now that we've dived into that, I just want to bring us back and to what I think is the most important point of this report. And yes, like it is the key takeaway that as you move from minimum wage to median work, there is a lot of work for us to do. But I think, bigger than that, it is this point that, Keith brought up from the report, and I love the word patchwork, right? Like we cannot have this patchwork approach. We have to understand these things holistically. And it is like a huge analytical lift to do that, right? And, a lot of us spend a lot of our time kind of trying to figure out what all the right simplifying assumptions are to make and what the implications are for those. But it's really important work. That's why it's really great that this report is engaging in that. And I'm really excited for the conversations it's going to open.
Thank you so much, Alex. And speaking of that conversation, I'm seeing some good questions come in already via the Q&A widget. So I'm going to start with one question of my own and then start pulling from there. I just found one of the images in this report so striking. I'm going to share it back out again. This is the image. Well, what I think is funny about it is when I lop off the image title, I think if you saw this set of graphs and all these lines, you would assume this is a graph of many different programs and phase outs. But this is the CTC structure across the 10 states. And looking at it, again, kind of backfilling, if I start with the graph, it's very hard to picture this as a graph of different groups pursuing one goal. So I'd love to ask our panelists, what leads to these wildly different approaches on the state level? We talk about states as the laboratory of democracy. Are they testing different hypotheses about what's needed for families? Are they working under different constraints? Because these are just really strongly divergent approaches to one program. And like you said, Alex, the thing about a CTC is it takes a long time for the data to come in. Which of these are working for families, which of these are failing them is something we won't be able to measure in a deeply quantitative way for 20 years. And by that point, all of these lines may have shifted or hopefully converged to an optimal pattern. So why do these states vary so much?
Yeah, I think the big factors are, you want to minimize costs, but maximize either poverty reduction or helping working class families or middle class families. So this leads to the question of like, what is the child tax credit for? And this is something we see at the federal level as well. But I think different folks in different states have had different answers to that question. In some cases, we've seen an emphasis on poverty reduction, which leads to a lot of income testing, right, where you get bigger benefits for a smaller proportion of lower income families. Some we've seen broad-based benefits, where you're just helping all families, but now including lower income families that were previously excluded. And I think a lot of those cases were building on what they already had. So in Maine, it's not in the report, but they took a non-refundable credit, they made it fully refundable. In Minnesota, they took their earned income tax credit and they more or less got rid of the phase-in and turned it into a child tax credit to reduce overall costs. Massachusetts did something similar with a pair of exemptions. And I think the other staircase question is, and again, this is where being on the ground in real time matters, is my understanding is that you have to have a revenue agency that can administer these benefits. And in some cases, states felt comfortable with a smooth phase out. In other cases, I think revenue administrators said, nope, let's do some sharp cutoffs here because this is what we know how to administer. So, those are things you can't take for granted, but there's no consensus on what the CTC is for. So we get all these different variations we see here.
Keith or Alex, do you want to weigh in on that?
Yeah, I think it's, you kind of see two different things depending on the states you're working with, right? I think you have states that already have this patchwork in place, and then when they go to expand their CTC, they have to figure out how to do it in a way that, holds everyone harmless, right? And a lot of times they start out with a really cool idea for a way to combine credits. But, then you start to get the projections in for costs, right? And you start to negotiate and navigate the political landscape, and you have to get it to work within a lot of real world constraints. And, you see changes get made and you get kind of some of the stair steps or other things you see where things get, it's very easy to move the phase out much earlier and decrease the cost of a program. So it can be very hard to navigate those things. And then I think you have some states, you know, like how do you trade off between a child tax credit, right, and a child independent care tax credit? And that's a really challenging thing. Do you go with one, or there are states where you can just pick what's best, and that creates a little bit of complication in people trying to navigate claiming these benefits.
Go ahead, Keith, if you'd
Well,
like.
really the only thing I would add is maybe a term that might be useful, which is bureaucratic inertia, like what Alex shared. It is the fact that we create these programs for a certain purpose, but over the years it can shift, and as we're making those tweaks within all these other policy constraints, this is how we get this sort of patchwork system. And so I think that that illustration of how all these different states have landed where they were was because within each of their sort of respective silos, they were that's just where they landed.
And I think the implicit marginal tax rates are an interesting example of where states can be penny wise and pound foolish, where you're shaving money off the cost of the program as you consider it, negotiate that size of the package. But the cost of these penalties for moving up and strengthening your family's position are less obvious when you're scoring a bill. We have a question sort of on that topic from Max Gaines, who says some reforms that aim to reduce the prevalence of high marginal tax rates, like lowering phase-out rates, can do the opposite by exposing currently ineligible people to the phase-outs. How would you consider quantifying the problem, and have you identified any reforms that address it? So as you try and soften the phase-out, you're exposing more people to the phase-out. How do you think about that trade-off?
Yeah, so I think, you have to trade that off with particular needs, right? So one way you could reduce a lot of these implicit marginal tax rates tomorrow is like just get rid of TANF, right? But we know the problem with that is you would leave a lot of families high and dry. So I think there's a case for expanding phase outs or expanding things upwards if we think these families are in need. And they're not already facing particularly high implicit marginal tax rates. So, universal programs is the ideal way to do that. But I think moving things above median where these other benefits aren't phasing out is most ideal. So Massachusetts is a good example. Vermont's a good example. It doesn't phase out until you start making 125,000 versus ones that you're increasing those marginal tax rates in the $20,000 to $60,000 range. That's where I think you run into those issues because the need is there, but they're already facing really high implicit marginal tax rates.
Keith, go for it.
I was going to add it. So I need to memorize the quote, but Warren Buffett once said, something to the effect of, I never worked more because my taxes went up, or never worked less because my taxes went up. Now, a key difference between him and most of Americans is, he was doing all right on his own. I think what gets lost in these conversations is what we're talking about with the loss of benefits is families are making essentially impossible choices, right? Like they're not yet earning enough to get by on their own, but then they're having to make decisions around, well, do I continue to receive SNAP benefits? Do I continue to receive health care for my children? And that's just a very different calculus. So yeah, I think it's a great empirical question that I don't have the answer to. And I think we do need to figure out is like, what is sort of, where is the efficiency? Like, is there a sweet spot we can get to? I don't have an answer to that, but I'm less concerned if we're setting thresholds such and phase out such that what happens is families are able to get to the point where they actually don't need the assistance anymore. Like, I think that my theory is that will pay for itself, right? Because what we have when we lower things and we we push people who aren't actually making ends meet into ineligibility is we're forcing them to make those decisions around, okay, do I just stay poor, right? Do I stay poor so that I at least know that I will have food and shelter and healthcare for my kids, versus being able to work to get ahead. So.
Yeah, I don't think I have a elegant policy solution to this. It's a great question. Thanks, Max. But I think it does bring up something else that I really liked about the report, and that is that the way it's set up, you're comparing within the state across these different families with earning levels. And it's really a struggle when you start comparing across states, right? Because the different costs of living, and do you believe the cost of living adjustment factor is always kind of a question. So I think maybe the first step in addressing this is Josh modeling this at more income levels so we can make more comparisons and see when you start to make these shifts, like where it's felt, right? And is that at a level in which we think a family could, realistically support themselves in that state?
And this brings me to a question I've had looking at this report and the other ways that state programs grow and intersect, and that the federal benefit changes and that the state program syncs up with it badly. Looking at all these complex intersecting programs, each addressed piecemeal, I was reminded about how Stuart Brand writes about architecture and how buildings learn. He says an architect has a responsibility to build a building that is capable of growth and adaptation, not to think they have a design that is static and will last unchanged the length of the building. Is there anything you think state lawmakers can or should do differently if they think of the laws they pass as needing to be a foundation to be built upon, not just the best deal they can get for this year, but something that's going to intersect with other changing programs in unexpected ways?
Go ahead, Josh.
Yeah, I think it's a tricky question, right? Because we have a federal system, so there's only so much state lawmakers can do, and a lot of times they're working with federal architecture that they have no control over. But I still think it's worth to, you can take a Canadian route, and they very explicitly got provincial leaders to work with federal leaders and had a whole movement of making sure social assistance worked with provincial benefits, worked with federal benefits, but it took them several years, and there's only 9 provinces and versus 50 states. But having state lawmakers talk to federal lawmakers about, hey, here's how these things are interacting with our minimum wage, with our TANF program, all these things can be helpful. But I think on a state level, it's even just taking stock of what you have, right? So states have CTCs, CDCTCs, TANF, all these different programs, and this goes to Keith's earlier point about making sure they're accessible. If you do that one-stop shopping that we've seen in some states where you can figure out who's eligible for what, but also making sure that none of these programs is seen as sacrosanct, where you can't necessarily change them, you can only add on top of them. And we've seen some of that in New York with a bill to consolidate a bunch of these programs into a bigger CTC. We saw Minnesota sort of quietly did that. We tout it, but they more or less scrapped their EITC to make a CTC. Same thing with Massachusetts, got rid of a pair of exemptions to make one big fully refundable credit. And I think that's where you begin to make progress. But you're gonna need to break down those silos to say, hey, look, we're reducing this program or we're replacing this program, but it's going to be simpler. Everyone's going to be better off. But those require a lot of conversations across groups that may not be talking because there are different advocacy coalitions. There are different committees at the state level, or folks are interested in some and not the others. And I think that's where it becomes trickier, is to think about what do families need, and how can we get it to them, versus I work with the CTC coalition, or I work on TANF because I'm in HHS. So that's where it's communication, having this landscape that we try to show here is going to be important.
I think one of the things we've noticed is a tension between state policy and federal policy lately is advance payments on state child tax credits, right? As states start moving to enacting these much more generous state child tax credits, there's an opportunity for them to advance those payments so that families aren't just getting one lump sum at tax time and kind of holding their breath until they get them, but have that money when they need it and to spend as they need it, right? And really the barrier to that I don't think any state has navigated is that they need a waiver so that that is not considered income for their SNAP benefit calculations, right? And this is something I was not even aware of. I have to give credit. We have a fantastic state policy analyst who's here, Allison McCourse, who wrote a memo on it. And it's such a hurdle for states to really navigate to provide families with the resources they need.
All right, I have one more question from the audience I want to make sure to get to. So this is from Anna Fogel. She says, Josh, you showed we made a lot of progress in reducing the implicit marginal tax rate for people at poverty level since welfare reform. We essentially pushed the poverty trap from the poverty level to those trying to move from minimum wage to moderate wage jobs. What were the most important policy changes that drove that progress over the last 30 years? Were they federal or state policy changes? And how can those achievements inform our approach to keep lifting that poverty trap going forward?
Yeah, so I think the biggest factors were the decline of TANF benefits. So after welfare reform, this was a federal change, but with less money, states ended up just spending less on these benefits. So those total levels went down. Now, some of that got made up with SNAP, which again, initially was very narrow, but we saw with, I mentioned broad-based categorical eligibility, those phase out thresholds moved up and started reaching more working class families. So that, I think, helped lower that of federal policy changes. And then the growth of the EITC. So, in the 70s, EITC was relatively small. Then it was with one kid, then two kids, with three kids. It's indexed, unlike TANF. So that really helped make work pay, as folks like to say in the 90s. And then we saw states sort of double down on all these things in terms of their own EITCs, adopting BBCE. But all those combined sort of led us to the state where if you look at some of those reports or some of those tables, I should say, the two biggest in each cases are usually like SNAP phasing out and EITC phasing out, with others playing that secondary role. So it's a success story, but it's also a drawback that I don't think we've seen until now. And there's different ways to do that. I had mentioned Canada did something similar where they consciously reduced social assistance and expanded the CTC to make it that folks on social assistance weren't any better off, but folks in low wage work and median wage work were better off. So they reduced implicit marginal tax rates by focusing their efforts on working class families, but with a very broad-based benefit.
Keith, Alex, any lasting lessons from welfare reform or further progress you see possible for states as we get ready to close out?
A really big question to go out on. I would say, just continue to consider it from the family's perspective. Listen to families, consider it from families' perspective, and focus on what it truly takes to get by in this country today, I think is where I would leave it.
Yeah, absolutely. I think it's really important to remember that, these are families' realities, right? When we talk about these total resources that they have, the median wage worker that Josh is modeling, that's like 50% of people in those states have that or less to provide for their family during a really critical period in their children's lives. So, thank you guys so much for the great report. This has been such a fun conversation.
Thank you so much. Thank you so much to everyone for joining us, to our panelists for their well-informed conversation. I'd love to see these conversations continue. Both you can keep track of all of our panelists' work. I'm dropping their links in the chat. You can bring any of these reports directly to your state representation. And just to keep advocating, I think really what I hear across everyone's comments for reality-based policy that takes into account both the reality on the ground and the reality of the landscape of policy that any new law is passed against. That when we're trying to make families' lives better and simpler and stabilize things for children coming out of poverty, we don't wind up making things overly complex or unexpectedly punitive. Thank you so much for joining us. It's been a pleasure to have you.
Thanks all.